Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about how to tab your medical coding books. Now I know I said books, but for the purposes of this demonstration, it is only going to be the CPT Professional Edition that I'm going to be demonstrating. Only because the tabs that came with this book actually came with the book. So this is the only one that I'm going to be doing. With the diagnosis book, that's something different. When it comes to tabbing the diagnosis book, I know AAPC has a different thing about how they do theirs, but I figured I would do one that would talk to both sides, because whether you take an AHIMA credential exam or you take an AAPC credential exam, you're going to need this book. Okay, so we're going to talk about this book today, and let's get started. Okay, so CPT Professional Edition. I tore this out already because to get ready for this episode. But this was in here. It's attached to this book, and this just has all the little tabs and the sections that they fall under. And then on the back here, it talks about how to customize your book, right? How to tab it. So it says use the printed tabs to flag the section openers of each section. Use the red tabs to flag key pages in the evaluation and management, radiology, category 2 and 3. Use the blue tabs to flag key pages in anesthesia, pathology, and laboratory, and the appendixes. Use the green tabs to flag key pages in surgery, medicine sections, and the index. And then finally, use the yellow tabs to flag codes that you commonly use in your practice, codes that you need to research further, or personal notes that you have taken into your code book. Obviously, I'm not going to use all these tabs today because I'm only going to demonstrate like how to put most of them on. So let's go ahead and get started. So the first section that we're going to come into is the evaluation and management. Now they did say that you want to put it where the section opener is, right? So you can put it at the beginning here. However, I think that because we already know all this, and usually by the time you are looking up a code, you are already into the section itself. So I would highly recommend putting it at the beginning here, where you see like the beginning part of the section and all the codes, they start listing them out. So I would put it there. And let's see, let me get this tab. And I'm going to put it, I'm going to bring this over, and hopefully it'll stay in the frame. Oh, and I wanted to talk about this real quick. Now, how do you layer the tabs? Well, I want you guys to look at this little white marker right here. Use that as your guide to where to put the tabs. Okay, that would be my suggestion, because that's what we're going to do here, and I'll show you how it comes out at the end. I'm trying to stay within the frame too, so let me just put this here, and if you guys could only see what kind of weird setup I have back here. There we go. So I'm going to put it right there on that, and we can keep going. Okay, and then the next section will be anesthesia. Okay, so this anesthesia section will get a blue tab. See, the blue tab for that. Then I can put it here. There we go. So see, there it is. And then we have the surgery section, okay, that talks about the surgery guidelines. There is a tab for that. Okay, put that right there. There we go. Okay, and then we have the integumentary system, okay. And it starts right here, so we're going to put this tab here. going to put it right there. Okay, there we go. And then we'll flip out of this section to the musculoskeletal section, my favorite section. As you all know, because I am an orthopedics and podiatry nerd. All right, so here we go with musculoskeletal. Put this tab right here. Yeah. Nope, I don't want to put it over the numbers. I want to put it just under. Okay, there we go. Yep. And then we flip to respiratory. So the colors are kind of similar, so that's how. Okay, but this is the start of the respiratory system right here. Get this tabby thing here. We'll put it right there. Ta-da! See? Perfect. And then we go to cardiovascular. Lots of illustrations. This is where it starts. Yes. I'm going to make sure I don't miss anything. Oh, I see I did. All right, so it starts, yeah, 3316 is where it starts. Okay, so we're going to put the tab right down here. Okay, I'm going to put it over here so y'all can see. Cardiovascular, right underneath there. Get out of there. All right. Okay. Cardiovascular is a big section. There's a lot of information in detail in cardiovascular. Then we have the digestive system, which is a pretty eggplant color in the book. Let's see. Get this right here. And right there we go. No, wait a minute. Hold on. I don't want to put it there. I want to put it right here. Okay. So that way we can just flip to it, right to it. Now, this is just how I'm doing it. Obviously, whatever makes you comfortable, do it. Because, like I said, this is just a suggestion. This is just how I would do it. A lot of people ask me about tabbing, and I usually tell them I don't do it, but I'm doing it for you guys because I'm a team player. All right. And now we are in the urinary section. Now, urinary is going to be broken down into urinary, and then it's going to be broken down into male genitalia and female genitalia. So there's a little bit of a different thing that we're going to do with the tabs here. But I am going to put this right here to mark the urinary. Right there. Okay. But then we're going to hit male first. Male genitalia. All right. And okay, I'm going to put it right here. Yes, it's another page right there, but I want to keep this PG. And while this is a learning thing, I don't want anybody to get offended. So yes, I have to consider these things as well, even though this is an educational thing. So I'll put this right here. Okay. But this is, of course, is not the beginning, okay? Now, male genitalia and female genitalia, the white marker is at the same place. So what do? Unfortunately, one is going to have to be a little bit under the other one. Well, I guess I could do it really underneath, or I can do it above. Let me just do it above, make it easier. Okay, so female, I'm going to put this above, put it right here. Okay. Yes. Okay, we can still see. And then, here we go. Now we are in the nervous system. And nervous system starts here, right? 6100. Yep. Okay, so I'm going to put the nervous system here. Right there. Okay. And then we have the eye and eye, ocular, and adnexa. Okay, but this is going to cover for the hearing as well. Okay, so because you see the audio right there, so I'm going to put this right here. Okay, and then we have radiology. Okay, radiology right here. And that's going to be a red tab. Because if you remember it from the front of the page, it said that to mark it with the red tab. So we put that right there. And watch how it's going to come out at the end. I love the way it comes out at the end. And I'll show you guys here in just a second when I get done. Here we go. Pathology and laboratory. Well, we're going to put it right here, okay, because you may need to see this right away versus just seeing the table of contents, right? So I'm going to put it right here. I'm going to start it right there. Okay. That's still in the frame. Yeah. Okay. Then we jump because path is huge. Path and lab is huge. Here we go. Come on. Come on. Then we have the medicine section. You like my my sound effects? Medicine section. Okay. Right. Lower this here a little bit so that I can reach it with my short arms. Okay. Now we have next, we have the category 2 codes. Okay, category 2 starts here. Codes start here. Okay, see, red tab here. I'm gonna put it right there. Okay, and then category 3. See, I turned right to it. Isn't that magical? Okay, we have category 3. Come on. There we go. Get on there straight. Let's be friends. Come on. All right. Okay. Then we have the appendixes. Now, guys, I will say this about the appendixes. I know I talk about the appendixes all the time, and I will keep reminding you guys, because if you have not explored the appendix section of the CPT Professional Edition, oh my gosh, you guys are missing out. So this says Appendix A through B. There's so much valuable information in this thing. And not only that, it will help you to better understand the little things about the CPT manual. Not only that, it will help you when you are going for like audits and you have to come up with arguments, and perhaps maybe the person doesn't quite understand that particular modifier or whatever, then you can know where to find it in the book. Okay, so that covers from A to B. Then we have C through F, but C through F is going to start here. This is also really good. It's examples of different evaluation and management levels, and like what something like that would be or whatever. Take a look at this, guys. I mean, this will give you a good rough idea of what constitutes a 99201, a 99202, 203, and so on and so forth. All of the evaluation and management levels, it gives you all good examples. Okay, it's just something good to go over, something just to sort of focus on. And then the next one we have is G through I. Well, G through J. This tab covers G through J. Okay, I'm going to put it right here. So again, make sure that you guys go through that, okay? And then we have one more with K through P. Am I going too far ahead? Yep, right here. Okay, and here is the final one. I'm trying to make sure that I'm still in the shot. Right there. There we go. Okay, so, and then the rest of it is that was the last tab for that one. And again, you can use any of these other ones that are left to cover anything else you need to tab, or you may want to tab specifically. Okay, so, but look how it comes out at the end. Ta-da! See? Now this is a little crooked, yes. Let's go ahead and straighten this up. I knew that was on there crooked. I knew it. Oh, okay. Let's see. Right there. Okay, there we go. And there's all your sections tabbed, okay? So that's how it looks when it's done. And I hope you guys enjoyed this demonstration. Again, however you feel comfortable tabbing your stuff. I don't think there's really a right way or a wrong way. Some people will tab them at the top. Some people will tab them anywhere, or they'll mix them up. But to me, this just looks really kind of neat and organized. For somebody that doesn't use the tabs, this would be like, I guess, helpful. But yes. So again, I hope you guys enjoyed it. I hope that you'll share this video. If this video helped you, please smash that thumbs up button. The more interaction I get on this video, the better it is for my channel, the more people that I can help. And you never know who you'll be helping by sharing these videos. Okay, so I will go ahead and see y'all tomorrow. But thank you for watching. And if you're a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. I will see y'all next time. Bye!